Welcome to the webinar where you're going to discover how to get the best healthcare you've ever had for up to 60% less than the cost of health insurance. How does that sound? Pretty great, right? Well, my name is Tom Lindsay, and I'm super excited that you're here because this is going to be life-changing. It was for me, and that's exactly why I can't wait to share it with you today. But first, I want to ask you a question. How do you measure the value of health insurance? Well, you do it by comparing the premium to the benefits, right? The value of health insurance has been declining at a rapid pace over the last 10 years. Premiums are out of control, and the benefits keep getting worse every year. We're at a point now where it just doesn't work. It wasn't working for me, and I have a feeling it's not working for you either, otherwise you wouldn't be here. It's not working because even if you can afford the premium, you can't afford to use the benefits. When you do, you have co-payments, a deductible, and now, more often than ever before, policies are coming out with a co-insurance obligation. If you've been trying to find affordable health insurance, then you know exactly what I'm talking about, right? So isn't it about time we get back to having a healthcare solution that provides real value? Well, if you said yes to that, then you're in the right place. Is the look on this guy's face familiar? Is this about how you react when you're looking at medical bills or health insurance premium? Have you ever been worried or stressed out because you can't afford to buy health insurance or keep your existing policy because it's too expensive? Even if you have it, the thought of using it and having to pay your deductible can be overwhelming. Look, I understand because I've been there, and it's not our fault. The system is broken. Plus, wages have stagnated, making it impossible to afford the massive increases in the cost of health insurance. I mean, just look at this chart. Since 2008, health insurance premiums have increased by 55%, and the amount that employees have to pay has increased by 70%. Meanwhile, wages have only increased 19%. We're at a breaking point, and something has to change. Well, how would it feel if you could put an end to the pain and suffering that you're experiencing from the stress and the anxiety that comes with not having or not being able to afford quality healthcare? Well, I know that it made me feel amazing, and I'll share that story with you in a minute. But before we go any further, I need to tell you what this isn't. This isn't an insurance policy. It's a medical cost-sharing membership, and it's completely different than insurance. Medical cost-sharing is a community approach to paying for healthcare. It's also not a health-sharing ministry. Now, you may have heard of a health-sharing ministry before, which is a sharing model that's been proven effective for the past 30 years. Well, this is based on a similar model, but the membership is not faith-based. And because this isn't insurance, there are no provider networks to worry about. You have the freedom to choose your doctor. Now, members pay a monthly contribution to the community, and those contributions go towards the eligible medical expenses of other members during that month. And finally, because this isn't insurance, the terminology we use to talk about medical cost sharing is intentionally different. So, what is medical cost sharing? Well, you already know it's not insurance. It's better. Medical cost sharing is a voluntary membership in a community of like-minded people who agree to help with each other's medical expenses. And members are guided by two overriding principles. The first is treating others how we would like them to treat us. When family and friends and neighbors are in need, we help. And it's this fundamental concept of helping others in need that forms the basis for medical cost sharing. People helping people when a medical need arises. The second is personal responsibility. In this case, responsibility for your health. And that means living a life where you pay attention to your health, a balanced life. It doesn't mean you have to be a health nut, but you also shouldn't ignore your health or overindulge in unhealthy behavior. So what do you think? Does that sound like something you could do? By joining a medical cost sharing community, you'll likely have much lower monthly expense. Overall, your cost of care will be lower because you'll have access to resources to help you pay less when you need to see a medical provider. And maybe best of all, you have total freedom to choose where you get care from, when you get it, and what you have done. No more insurance company provider network, no pharmacy benefit manager, no one getting in the middle of you and your relationship with your doctor. Now, the number of people participating in a similar or faith-based sharing membership totals over 1 million, and over $1 billion has been shared. Membership in alternatives like medical cost sharing is growing fast because it works. We've chosen Sedera as our medical cost sharing community. In my opinion, they offer the best overall value of any sharing arrangement available. Sedera is based in Austin, Texas, founded in 2014 by Dr. Tony Dell, who's a former physician from Great Britain. And the Sedera community is over 17,000 members strong. Now, I'll tell you more about Sedera in a few minutes, but right now, I want to share with you some of their members' testimonials. Jill said, "My first experience utilizing the Sedera community came when I had an emergency C-section with my second son, and then he spent 10 days in the NICU. Throughout the sharing of the need, I saw how the community works through a compassionate team at Sedera. I was completely shocked at how easy it was and how much I liked being a part of the process. This was so significant, I asked Sedera if I could come work for them." And Lisa Hudson said, "This experience with you and Sedera concerning my needs request has been the polar opposite, in a very good way, of the normal insurance process and is such a welcome relief." And Hakub said, "You're definitely friendlier on the phone than insurance. I want to call you just to talk to you. And you gave me all the information I needed in 5 minutes. To get through to someone in health insurance takes forever. You addressed all my issues, and I have 2 hours back in my day. I would put that in your marketing material." Well, you might be wondering about now if this is right for you. So let me ask, do you want to lower your costs for healthcare? Would you like to have the freedom to choose from whom, when, and where you get medical treatment? Do you want high quality care and access to a suite of innovative resources and amazing member services? Well, if you said yes to any one of these, then this is for you. It's for entrepreneurs, the self-employed, small business owners. It's for individuals who work for an employer who doesn't offer insurance or where the insurance is too expensive. It's for people who are between jobs or who just want healthcare that isn't tied to an employer. So what do you think so far? I hope you're as excited about this as I am. When I first learned about medical cost sharing and specifically Sedera, I couldn't wait to dig in and learn more, which is exactly what I did. And now I want to share that with you. What I want you to get from this webinar is that the only way to get the best healthcare you've ever had for 60% less than health insurance is through medical cost sharing. And the only way to get the best medical cost sharing is through this arrangement. Our goal is not to fix what's broken, it's to replace it. And this is the replacement. Let me quickly tell you a little bit about me just so you can see that I might know what I'm talking about. I worked my entire career in the HR and insurance industries, mostly as either the CEO or COO of 2 different professional employer organizations, which are also called PEOs. Now, PEO provides small and mid-sized employers with payroll, HR, employee benefits, work comp insurance, and workplace safety services. And I've been responsible for providing benefits to thousands of employees over my career. I'm a licensed insurance broker, and I hold the Chartered Property Casualty Underwriter certification. That certification is considered the most distinguished designation offered in the industry. And in my free time, I'm usually out riding my mountain bike or spending time with my family. So after working for 23 years as an executive in the PEO industry, I decided to sell my shares and resign for a change of scenery and less stress. And I wanted to spend more time with my wife, our 13-year-old daughter, and our 1-year-old son. But I wasn't prepared for the changes and the challenges that I was about to face. I didn't realize how much of my identity was tied to my role as the current COO. This was a company I had founded back in 2003. And it was kind of like finding out now that I was adopted. All of a sudden, I'm asking myself, who am I? Because now I'm a small business owner with 3 full-time employees. And I struggled for the next 12 months to kind of regain my confidence, hoping that I wouldn't regret this decision. Have you ever made a decision like that before, where you've left the security of a job to chase a dream or take back control of your time? If you have, then you know exactly what I'm talking about. But my fragile emotional state wasn't my biggest challenge. Health insurance was. So for the past 23 years, I'd always had 100% employer-paid, top-of-the-line insurance, and now I was faced with having almost no options and 50% less income. I was a health insurance bum. I didn't have benefits, and I couldn't find an affordable plan from either the health insurance exchange or the private marketplace. It was embarrassing, and I didn't want to tell my wife that we were going to be uninsured. All of the options that I was aware of were terrible. The premium was crazy high, and the benefits were poor. So I chose to go with the best of the worst and get a short-term policy that had a $10,000 deductible and a 20% coinsurance. So it's super expensive if I ever had to use it. Basically, it's catastrophic coverage, something that would help me avoid bankruptcy if a major medical issue happened. I knew that this wasn't sustainable, and for a while, I actually thought about returning to my job. Well, I didn't really want to do that, so I started scouring the market for other options, and I want to share with you what I learned. Not long after I left my corporate job, I decided to team up with my former business partner, John Irillo and Steve Rigby, who were actually doing the same thing I was, selling PEO services to small and mid-sized employers. And over the past 25 years, the three of us have owned and operated several companies in the HR, financial, and insurance industries. And now we were joining forces to find answers to the healthcare mess for our employer clients. And it's this partnership that led to the discovery of the Sedera Medical Cost Sharing community. At the time, our focus was on employers, but our experience taught us that employers don't always make the best health insurance purchasing decisions, and it leaves their employees at a disadvantage. Plus, as entrepreneurs, small business owners, husbands, and fathers, we needed to find a solution to our own healthcare affordability problem, especially me. Now, we also realized that the employment market has changed dramatically over the past 5 years, with technology making it easier for individuals to start their own business and to work remotely. But the lack of affordable healthcare has made that stressful and prevented many from taking the leap. So we decided to become a Sedera sponsoring entity, and we created Pure Health so that we could bring medical cost sharing to individuals like you. Well, let's get back to talking about the problem. Have you ever been confused when it comes to your health insurance and the healthcare system? I have, and I'm in the insurance business. Have you ever felt like healthcare is way too complicated to understand without having insurance? It's almost as though the system was designed to confuse us. From my experience, I already knew that there were several types of companies involved. You have insurance companies, drug manufacturers, third-party administrators, provider networks, pharmacy benefit managers, and pharmacies. And these companies make up our healthcare system, and they can make getting access to healthcare complicated. It's a big business. It's very profitable. And these companies generate great returns for their shareholders, as they should, but it comes at our expense. The competition drives prices down, but in the healthcare system, the opposite's happening. For example, the largest pharmacy benefit manager just merged with a large health insurance company, and a well-known pharmacy just merged with another large health insurer. These mergers are happening to increase profits and give health insurance companies more control, which isn't a bad thing as long as that results in lower costs or better benefits. But that's not what's happening, right? Costs are up and benefits are down. Well, during my research, I investigated all the available insurance options. I read hundreds of articles. I bought 2 books about health insurance reform. One of those was called Health Wealth for You by Dr. Josh Luke. You actually already have part 2 of his book because when you signed up to watch this webinar, we sent you a copy. I also attended a seminar sponsored by the Arizona Health Underwriters Association where I heard an expert named David Contorno speak about the broken healthcare system and how to begin fixing it. His presentation was the straw that broke the camel's back for me. What it boils down to is that the healthcare system has made healthcare unaffordable. There just isn't much of an incentive in the system for them to lower costs, which is why it's plagued by overbilling, overpaying, and excessive treatment. For example, Contorno explained that a PPO network is a closed-door, backroom secret negotiation between 2 entities who both benefit when costs go up. And Dr. David Belk says, private health insurance companies deliberately overpay hospitals to ensure that their revenues continue to grow each year. Hospitals overbill persistently and excessively. The most obvious reason hospital overbilling has increased so persistently is that hospitals can make more money by doing it. And a recent example of what's happening in the industry was reported by 60 Minutes. The story has to do with a pharmacy benefit manager, or PBM. And a PBM is a company that creates a prescription menu called a formulary, and then the insurance companies add those formularies to their health insurance policies. Well, the largest PBM in the US was sued for price fixing because they removed the only competing drug for treating infant spasms from their formularies, meaning that the drug manufacturer was cut off from the health insurance plans. And that forced them to sell the drug to a competitor. Well, that competitor took that drug and put it on the shelf and then raised the price of their version of it. As a result, the cost went from $40 per vial to more than $34,000 per vial. Are you getting this? Overbilling, overpaying, price fixing, and hidden deals to conceal the true cost. The more I learned about why healthcare is broken, the more I realized just how big a problem this is. Pharmacies are also a big part of the problem. Basically, unless there's no generic drug, you'll save money by not using your insurance to buy your prescriptions. Neither your insurance company or the PBM or the pharmacy want you to know how much drugs actually cost or how much you could get generic drugs for without using your insurance. Then there are the drug manufacturers. There's an antitrust lawsuit in motion right now involving 16 drug companies and over 300 generic drugs. 43 states are participating in the lawsuit, which alleges many of the country's leading generic drug companies engaged in price fixing by working together to inflate the prices of their drugs to keep profits high. BenefitsPro.com is calling this an illegal price fixing scheme of massive proportion. So, as you can see, the more I learned about why healthcare is broken, the more I realized just how big a problem this is. Have you ever not gone to the doctor because your insurance policy's out-of-pocket costs? With insurance, you pay a copay when you go to the doctor. If you have a procedure done, your deductible kicks in. If you have a major medical event, you might have to pay 20 or 30% of all the costs even after the deductible. If you have an emergency situation and you end up in the hospital that's not in your plan's network, you're likely responsible for up to 70% of the costs. Even if you do end up at a hospital that's in network, the surgeon or anesthesiologist could be out of network, and you'll be charged the difference between what the benefit your insurance pays for out-of-network services and the full bill. This is called balance billing, and it's been getting a lot of attention in Congress lately. You've probably heard about it in the news, right? But the latest trend is to lower co-pays so it looks like the benefits are better, but then increase the co-insurance, which actually makes the cost more expensive for you. Most people don't know what co-insurance is, so it's an easy way for the insurance companies to hide the increase. Basically, there isn't anything transparent, straightforward, or easy to understand when it comes to health insurance. In 2018, a family of 4 paid an average of $28,166 in premium and other out-of-pocket costs. I mean, how much do you have to earn before that becomes affordable? Even if you make $100,000 a year, after taxes, that's a big percentage of your net income. It's so bad that we Americans had to borrow about $88 billion to pay for healthcare in 2018, and 1 in 4 people went without care because of costs. You probably know someone who's either gone bankrupt or is deeply in debt due to medical bills, even when they had insurance, right? I know a few myself. But now, thanks to medical cost sharing, you have a lot less to worry about because the membership is up to 60% less than insurance and your out-of-pocket expenses can be significantly lower. Isn't that exciting? I can't tell you how relieved I was when I found out about this, and that's why I'm so excited to share it with you. Can you see that stress going away, knowing that you have this huge problem solved? How would that make you feel? But even though I was super excited, I didn't want to get my hopes up too high because as an insurance professional my entire career, the idea of medical cost sharing versus insurance made me a bit nervous. I've been involved in many different types of health insurance products over 25 years, and I wanted to make sure that this model was designed right, administered professionally, and just, working properly. So I started researching medical cost sharing companies. I really dove in, just like I did to discover the facts about what's really going on with health insurance. I had numerous conference calls and meetings. I scoured the websites of every health share I could find. I read their member guidelines. I called several of them, and I met with Sedera. I even wrote an extensive article for the Agency Builder blog about health sharing versus insurance. What I've learned throughout all of this is that even though there's no perfect solution, this is as close as you can get today. And from a value standpoint, it really is unmatched. Once you see how much the monthly member contribution is and what medical expenses are shareable, I think you'll agree. What's possible now is a distinctly refreshing non-insurance approach to healthcare. How refreshing, you ask? Well, in this comparison, it's about $1,103 a month refreshing. While preparing this presentation, I got a quote for me and my wife and our 2 kids from Standard Life for a $500 deductible health insurance plan. The monthly premium was a whopping $1,765.61. Forget about it. That's crazy, right? But the cost for us to have a Sedera membership is only $662 a month for a $500 initial unshareable amount, which is what the member is responsible for per incident before sharing with the Sedera community. That's $1,103 less per month, a 62% savings, over $13,000 per year. It's huge. By the way, Sedera's monthly share is priced by age band. So if you're young, between 30 and 39, The same $500 IUA is only $585 a month for family. Change is good, wouldn't you agree? Because we are completely cutting out the insurance company, there is no middleman between you and your doctors. You have the freedom to choose your providers. There's no network or pharmacy benefit manager telling you where to go or telling your doctor what treatment to provide or what prescriptions he can prescribe. You get to see who you want, when you want, and get the treatment you need without a middleman being involved. Those are some great changes, right? You get so much more for your money with Sedera. Just to get similar services, I'd have to spend $1,795.60 a month. And even then, Sedera's value is better overall. For example, the Standard Life has an annual max benefit of $1 million. With Sedera, my eligible medical expenses are not limited. When it comes to insurance for coverage for pre-existing conditions, the Standard Life has a 60-month look-back. Any condition you have going back 60 months is not covered. But with Sedera, the look-back is only 36 months. Here's an example from a Sedera member of the difference between health insurance and medical cost sharing. The McMahon family has a 1-year-old child suffering from persistent ear infections. Their health plan had a deductible of $2,500. Care for the child required a series of antibiotics and booster injections, and a visit with an ENT specialist who inserted tubes in the child's ear at a local hospital. Here's how that need looks with their health insurance plan versus Sedera. Their out-of-pocket costs with the health insurance is $2,275, but with Sedera, they're only responsible for the first $500. That's a savings of $1,700. Pretty great, right? Well, doesn't that sound like a breath of fresh air? Look, this works because as individuals, we help our family and neighbors when they're in need. We also take personal responsibility for ourselves and we cherish freedom. These principles are the foundation of the Sedera Medical Cost Sharing membership. Sedera coordinates the sharing of medical costs between their members, in other words, the community, and the program's modeled after the proven highly successful healthcare sharing ministries that have been doing this for more than 3 decades. Sedera's founders have been deeply involved in the business of medical cost containment for the past 22 years. Their purpose is to facilitate the medical cost sharing for the community and to encourage everyone to maintain their health. Membership is not refused on the basis of your health status, but medical conditions that existed prior to membership may be limited as to how much of the cost is shared or excluded altogether. In other words, no one is denied membership based on their prior medical conditions. As a member of Sedera, you are a cash pay patient. Simply have the providers bill you directly, then submit your bills to Sedera as a need. A need is all of the medical expenses related to a single injury or illness. And Sedera reviews your needs, and when eligible, they share it with the community and send you the amount to pay your providers. And you have the freedom to roam, to see whatever doctors you want, to go to whatever hospitals you want, and to receive care from any provider you choose. So wouldn't you like some of that fresh air? Look, if you've been struggling to find affordable health insurance, it's because it's rare and typically only available to employees of large companies where the employer pays a significant portion of the premium. But even then, once you go to use the benefit, the cost can be crippling. You might be struggling because you're a small employer, or you work for a small employer where the insurance plan options are expensive and the benefits are poor. If you're self-employed, your only options are the health insurance exchange, individual plans outside the exchange, or short-term policies. And these are all lousy options. I've tried them all, and it's the same story. They just lack value. This is exactly why I was struggling. I left my job, where I had 100% employer-paid health insurance, and became a small employer where insurance was simply unaffordable and my options were bad. But now, thanks to Sedera, I'm getting the best healthcare I've ever had, and it's a lot less expensive than insurance. Here's kind of how it works. I pay my monthly contribution. Then when I need non-emergency medical services, I call Sedera with questions and get a refresher on the membership guidelines so I know exactly what expenses are shareable. They will help me find the highest quality provider for the best price, or I can go to a provider of my choice. There's a lot less paperwork when I arrive for my appointment because there's no insurance information that has to be processed. I show up as a cash pay patient and have them bill me directly. If my doctor is recommending a non-emergency procedure, I call 2nd.MD, a second opinion service, before scheduling the procedure. By the way, I'll tell you about 2nd.MD in a little bit. When I get the itemized bills, I submit them online to Sedera as a new need. At this point, Sedera may attempt to negotiate down larger bills. Next, they send me the money to cover the qualified expenses less my IUA. Then I pay the providers according to the explanation of needs shared form, which they send to me along with the payment. So it's a bit of a different mindset than dealing with insurance, but it's so much better. I feel empowered and free, and I actually enjoy being involved in the cost management because I want to keep those costs down, not only for myself, but for everyone else in the community. So could you see yourself doing the same thing? There are 3 secrets that the healthcare system hopes you never learn. They don't want you to escape their control, but that's exactly what you're going to be able to do when we're done with this webinar. Are you ready for these? Secret 1 is how to get high quality healthcare without an insurance company. Secret 2 is how to take control of your healthcare away from the insurance company. And secret 3 is how to get the best healthcare you've ever had for 60% less than health insurance. So secret 1 is about eliminating the middleman. When you eliminate the middleman, the health insurance company, you actually get higher quality healthcare. Wendell Potter, a former insurance company insider, wrote in 2014 that his former boss, the CEO of a large insurance company, once said that what kept him up at night was the possibility that Americans, business leaders in particular, would ultimately conclude that insurers were an unnecessary expense. So there you have it. They know you don't need them. They just hope you don't find out. I've been in the insurance industry my entire career, and I used to think exactly the way the insurance companies want you to think, that the only way to get healthcare is by purchasing health insurance, and the only way to get health insurance is to work for an employer who offers it, or go through an insurance agent or broker to get an individual policy. But either way, you end up buying an overpriced policy from an insurance company. When I left my cushy corporate job, I lost my healthcare. I was 46 years old and I had never been without it. And until then, I'd never had to try and get it. I knew my options were limited and that it was going to be expensive, but I had no idea just how ridiculously unaffordable it was. I had 3 choices and they were all bad ones. I ended up going for a short-term policy that had a $10,000 deductible. It was basically just a policy to keep me from going bankrupt if something catastrophic happened. With such a high deductible and a low lifetime benefit of $750,000, it was a terrible bankruptcy prevention plan. I'm not sure what I was thinking, other than I couldn't stomach the thought of being uninsured. And if I'm being honest, I was more worried about what family and friends would think if they found out I didn't have health insurance. I knew it wasn't sustainable, and I knew I had to figure something out because it was constantly on my mind. Now, the current system is built around a host of third parties, which almost always results in confusion and a lack of transparency. They get in the way of your relationship with your doctor. 5 insurance companies control the healthcare system for more than 125 million Americans. And probably the biggest eye-opener is that if current trends continue, millennials will end up spending more than half their total lifetime earnings on healthcare. Advisory.com reported, according to a Federal Reserve research paper published in 2018, that millennials currently spend nearly twice as much on healthcare as the previous 2 generations did at their age. Look, if you want different results when it comes to healthcare, stop doing the same thing you've always done. Jason McKinley is an insurance agent and a Sedera member. Like me, Jason prefers the medical cost sharing model over insurance because it works for him like it works for me. So I want you to hear what he has to say.
My name is Jason McKinley, and we're in our home office at my insurance agency, M&D Insurance Services in Austin, Texas. We're a full service agency, so we'll do someone's homeowner's insurance, their commercial P&C, their benefits, obviously. I think the healthcare industry is broken. Everyone continues to get an increase in their premium every year. And a lot of times that increase comes with a decreased amount of coverage. Business owners love Sedera. Again, with the cost savings that come with it, the employees are the real winners, I believe. A lot of times employers will end up paying for dental or vision or making a contribution towards the health savings account because of the amount of savings they have. I love to help people and I love to solve problems and I love relationships. So in what I do, all that is encompassed. With Sedera, sometimes I've got to apologize when I'm leaving and say, hey, I'm not trying to sell this to you. I'm passionate about it because it's worked for me and it's worked for my family. You guys ready to shoot some hoops? I don't think what's happening today in this industry is sustainable. My hope is that we move more towards options like Sedera. Sedera is not insurance. It's an entirely different solution. It's got a different philosophy. And I like to say they take the middleman out, so you're dealing directly with your own healthcare needs and not having to go through the carrier. We're so trained in this healthcare system, we go where the doctor tells us, we slap our insurance card and our credit card down, and we don't even ask questions. What Sedera has done for my family, it's trained us to shop for our healthcare needs just like we shop for everything else. You know, I think a lot of people are drawn to Sedera because of the price. I don't like to sell on price, and I don't like when people buy on price because most of the time you get what you pay for. I do think Sedera though has the best value, even though typically they're 30 to 50% less than what a business owner is paying. So I tried not to allow them to make the leap just based on price. I want them to understand the product, and I think once they do, they love it. But it's really hard for a business owner to go back to the way it was once they've experienced the transparency, the cost savings, and the freedom they have with Sedera. Really haven't had a customer leave once they've had Sedera. I've had a hard time finding a negative review about Sedera. But I think the biggest tell when you're looking at any organization is, are people loyal to them? Do they do what they say they're going to do? Do they have a good product, and do they do it timely? And Sedera does all three of those things, and they do it well.
Well, there you go. Jason says Sedera has the best value, and I couldn't agree more. Well, here's another example of a Sedera member who needed 2 surgeries to repair a problem with their hip. The total cost was $234,000. The member paid their initial unshareable amount, and the rest of the cost was fully shared with the community. Now imagine how much it would have cost with typical health insurance, especially if the treatment had spanned multiple calendar years where the deductible resets. Look, medical cost sharing works. It works for millions of people, including Jason, Juliet, Lisa, and Hakub. It's working for the employees of Crowder RV and Aztec Bolting, and for the employees at the law firm of Peak, Tolan, and Castaneda. It's also working for people who are close to me, including my brother-in-law Robert Attridge, my friend and attorney Robert Morley, and his employees at his law firm, and for my friend Matt Tonioli and his employees at Superstition Springs Endodontics. But best of all, it's working for me and my family. Financial expert Dave Ramsey endorses a health share, and he highlighted one on his radio show. He attested to the success and to how their members have been successfully sharing medical bills since 1981. Attorney and political commentator Ben Shapiro said on a video podcast that voluntary associations like health sharing arrangements are necessary to lower healthcare costs and improve quality. Mike Huckabee featured a health share on his show, telling his viewers that it's unique and remarkable. And Steven Crowder announced on his YouTube channel during an episode about Medicare that he and his employees are all uninsured and instead are members of a health sharing program. So medical cost sharing works for anyone who wants to lower their cost of healthcare, protect their savings and credit, for anyone who wants to sleep better at night or get their parents off their back. It works for people who want to start a business or to get off an expensive COBRA plan. And it works for anyone who's getting married or getting ready to start a family. You can confidently say goodbye to your health insurance plan and get uncommonly high levels of service and superior healthcare through Sedera's medical cost sharing membership. Sedera uses the best innovations from the modern sharing economy to deliver medical cost sharing along with telemedicine, medical bill negotiation, expert second opinions, and member advisor services. They bring people like you and me together, and we agree on which expenses we are going to help each other with. We pay a monthly share, and Sedera distributes it to those who have a qualified medical need. As a member of Sedera, we aren't looking to make a profit off of each other. In other words, there's a much better way to get healthcare than from an insurance company. We just need to stop trying to fix what's broken and replace it. So it's time you declare your independence. You do that by cutting them out of the healthcare transaction so you can start having a real conversation and a real relationship with your doctor and their teams. When you cut out the insurance company, there's no policy, no network, no one telling you where to go for treatment, and no one telling you or your doctor what treatment you can have. There's no inflated costs, no confusing bills, no complicated explanation of benefit statements. It's just you and your doctor and your member services team at Sedera. When you eliminate the insurance company from the healthcare equation, the whole world changes. What do they do for you anyway? Well, they become contractually obligated to pay for your healthcare according to the policy terms and conditions. But make no mistake about it, They're in control. They tell you what they will pay for, who you can get treatment from, and they tell your doctor which procedures to use and which drugs they can prescribe. With Sedera's medical cost sharing program, no one is contractually obligated to pay for your healthcare, but the community is there making their monthly contributions just like you to pay for each other's eligible medical needs. And it works. And it's been working for 30 years. It's too bad I didn't know about medical cost sharing in late 2016 when I lost my health insurance. I could have saved myself a lot of stress, anguish, and embarrassment. But even when I had health insurance, it left me frustrated. And after one particular incident, $2,800 poorer. And I was totally humiliated that I let myself get railroaded. I don't understand how I could be so dumb. I'm an insurance guy. Well, here's what happened. On a Sunday morning in January 2016, I injured my ankle while mountain biking. It hurt really bad. I thought I was broken, so I went to the Gilbert Emergency Hospital, thinking it was an urgent care. Now I know what you're saying. It's got hospital in the name. But in my defense, this wasn't a typical looking hospital. It looked and felt like an urgent care. But that was my first mistake. My second mistake was assuming the facility was in my current network. I didn't think to question that since I'd been there before. So after an x-ray and spending not more than 5 minutes with a doctor, I was done. And upon checking out, I was charged $700, which totally shocked me. And that leads me to my third mistake. I didn't ask before getting treatment what their service rates were. Had I known, I could have gone somewhere else. Then to add insult to injury, literally 2 months later, I get a bill from the hospital for an additional $2,100. That's $2,800 for an x-ray and 5 minutes with the doctor. My insurance paid $0 because it was out of network. Why didn't the hospital tell me how much it was going to cost? Why didn't I ask? After I gave them my insurance card, why didn't they tell me that they weren't in my provider network? And why didn't my insurance company negotiate the bill down for me? Well, the same scenario plays out in a totally different way with my Sedera membership. I would have saved over $2,300. First, I could have called the telemedicine number and talked to a doctor who probably would have told me that it's not an emergency and to call Sedera for the best place to get an x-ray. My total would have been less than $500. But let's say I didn't call and went to the same provider anyway. I would have told the hospital I was a cash pay patient. I would have asked for their price and would have most certainly paid less than half, because the real cost for the treatment I received is at least 80% less than what I paid. You can see that right here, according to Fair Health Consumer. The charges should have been $451 for a 3-view x-ray of the ankle and a doctor consult. With Sedera, you're not left alone to wander around aimlessly in the cold, dark healthcare world. In fact, now that you're no longer limited by a plan or insurance contract, you're surrounded by service like you've never had before. First and foremost, you have a member services advisor, kind of a new best friend who can help you research the cost for treatment, find quality facilities, as well as help you get the most out of your membership. You'll also get Second MD's services, which are simply amazing. And I've never seen this offered before, but you get it free with your membership. And the icing on the cake is the telemedicine provided by Teladoc. This is 24/7 unlimited access to medical professionals. Sedera's member services advisors are like having a personal healthcare coach. They're here to help educate and arm you with the resources you need to be a savvy healthcare consumer. Because of this coaching and personal touch, it's a night and day difference compared to what you're used to. You should call even when you're getting treatment that's not shareable, like for situations where the treatment's either excluded or it falls within your initial unshareable amount, because they're going to help you find the right provider. Your advisor is there to guide you through the medical maze, to eliminate stress, and to ensure that you get the most value out of your membership. Here's what David and Sharon Robinson have to say about member services. After years of dealing with insurance companies, we finally have someone on our side who's looking out for our best interests. Wasn't that awesome? Wouldn't it be great to get actual service instead of the runaround? And how about this? Have you ever had to wait months to access a specialist? Or have you ever had to go back and forth with your doctor and insurance company to get a referral? Have you ever tried searching the web for answers to medical issues and just ended up more frustrated and confused than you already were? With Sedera, your frustration and confusion are a thing of the past, because with 2nd MD, you'll be quickly connected with some of the world's best doctors for a consultation via phone or webcam. These are highly distinguished, hand-picked experts in 120 different subspecialties. These doctors are department heads, research leaders, and even NBA and NFL team physicians. And they hire the best, right? There's no other way you can get the doctors who are taking care of these multimillionaire athletes to provide you with their expert advice. Now, there are 4 times when you should use 2nd.MD. When you have a new diagnosis, when there's a possible surgery, a change in medication, or a chronic condition. Using 2nd.MD is going to improve your treatment plan and avoid unnecessary surgery, and according to some members, even save your life. But rather than me try to explain it any further, let's watch 2nd.MD's video.
So you finally got a diagnosis, and it's not good news. You're anxious, confused, and need some answers. Maybe a second opinion will help. There's an opening in 8 weeks. So you wait, fill out paperwork, wait some more, only to find that the doctor isn't up to date on the latest treatments or needs to refer you again. The best doctor for you is 2,000 miles away. You could search the web for answers, but you never really know who to trust, and you're overwhelmed by the information. You've barely started your journey, and you already feel defeated. You wish you could just speed past all the insurance companies and outrageous fees, all the waiting and paperwork and worry. And now you can. With 2nd.MD, you go straight to the experts who know exactly what you're dealing with. You get the care you need on your terms, and transparent pricing ensures there are no hassles over insurance. It's simple. Choose a specialist, choose a time, and get some answers. Specialists are handpicked from top institutions. So when we talk about our experts being the best in the world, we mean it. Consultations by phone or webcam mean location is irrelevant. No matter where you are or what you're dealing with, you deserve the best information available, and you shouldn't have to fight for it. Get your second opinion from 2nd.MD and get the peace of mind you need. 2nd.MD, direct access to the world's best doctors.
Isn't that amazing? And it's included in your Sedera membership. Oscar loves 2nd.MD. Here's what he has to say. For the last 5 years, my health has been getting worse. I had headaches, nausea, vomiting, weakness, and vision problems. I had to go on FMLA. I couldn't travel or play with my kids. During my 2nd.MD consult, Dr. Raymond suspected that I was suffering from a slow-growing type of blood cancer. My treatment began soon after, and my symptoms began to go away. Within weeks, I was back at work full-time, and I am now essentially symptom-free. I no longer have the headaches, vision problems, weakness, or nausea. My family and I are extremely grateful to 2nd.MD for providing a life-saving consult. And Natasha and David think 2nd.MD is pretty amazing. Natasha said, my husband and I took our 4-year-old son to over 40 different doctors, and none of them could tell us what was wrong with him. One consultation with the right doctor through 2nd.MD got us the answers we so desperately needed. 2nd.MD is amazing. Well, with Sedera, you also get telemedicine, which is an absolutely brilliant service, and Teladoc is the leading provider. If you've never experienced the joys of telemedicine, then you're really missing out on one of the greatest inventions in healthcare. Okay, well, maybe that's an exaggeration, but seriously, it is awesome. It's never not available, and 92% of the issues are resolved on the first call. Teladoc has over 20 million members, and you'll be surprised at how many conditions they can treat over the phone. Here's a quick example. Just before I had Teladoc services, I came down with a nasty cold, was the worst I've ever had. And I never go to the doctor for a cold, but this time I had to. So I went to an urgent care. It cost me $190 and took 2 hours. And I spent 5 minutes with the doctor. Had I had Teladoc, the cost would have been $0, and maybe it would have taken 15 minutes on the phone. Let's watch this testimonial from Laura, a Teladoc customer.
I'm a working mom with 4 kids, ages ranging from toddler up to teenager, so it is really challenging when one of them gets sick. Scheduling a doctor's appointment is always an inconvenience because I usually have to miss work and work around the kids' school and activities. So having an option like Teladoc is a game changer. I can talk to a doctor anytime, 24/7, from anywhere, whether I'm at home or in the office or even in the car driving my kids around. So it is a huge help. The doctors that I've interacted with from Teladoc have been really great. They are always courteous and caring about the situation that we're dealing with, and they are experienced in their field, whether that's pediatrics or emergency medicine. So I always know that I'm dealing with a competent doctor, And one time my son had a severe diaper rash, and the doctor was able to identify it from a photo and get him a prescription within an hour, which was amazing because he was in a lot of pain, and it would have been awful to have to wait a day or two to see our normal pediatrician in order to treat his rash. So that was a great experience. The Teladoc app is really easy to use. I have my whole family in my account, so I can request a visit for any one of my kids or even my husband, and I can decide if I want to talk to a doctor at a specific time or have someone call me back as soon as possible, which is what I usually do. And I have experienced really short wait times, and I'll get a call back in less time than it takes to even drive to the doctor's office or to urgent care. So it's a really convenient and easy way to get healthcare.
So there you go. A convenient, easy way to get healthcare in less time than it takes to drive to the doctor. And finally, Sedera introduced me to GoodRx. You don't have to be a member of Sedera to use it, so even if you never join, you should use it. The first time that I did, I was shocked by how simple it was and how much I saved. I never imagined that getting a prescription without using insurance could cost less than using insurance, but it's true. In fact, Dr. Oz featured GoodRx on his show. There's a good chance you've already heard of GoodRx because it's been featured on several major media outlets. I have the commercial right here, so let's take a look.
Hi, Linda. Looks like you've got a prescription to fill. Any idea how much that's going to cost in there?
I'm really not sure.
Well, you're probably going to pay 2 or 3 times more than you should in there.
What?
Let me show you how I know. Most people have no idea that drug prices vary. The exact same drug that's $10 at this pharmacy is $150 at this one.
I had no idea.
It's crazy. But here's how to fix that. GoodRx finds prices and discount coupons on every prescription. Just go to GoodRx and put the drug name and instantly find savings at virtually every pharmacy in America. Best of all, it's free.
Look how cheap it is there.
It is. You should swing by and Okay, great. By the way, GoodRx can save you money even if you have insurance. And it works for every member of your family, even pets.
Next. What can I do for you? Hi, here's my prescription, and I have a coupon from GoodRx. Nice price. Thanks. You're welcome.
Stop paying too much for your prescriptions. Find the lowest prices at local pharmacies with GoodRx.
So whatever you do, don't go fill a prescription without checking with GoodRx first. So what have we learned? We've learned that when you say adios to your health insurance and join Sedera's medical cost sharing community, you get amazing customer service, access to world-class physicians, and the game-changing benefits of Teladoc. Not to mention the fact that your eligible medical expenses are shared with the community when you need them. I think this graphic is pretty cool because it summarizes what's happening. The new model, medical cost sharing, is a revolution, a healthcare revolution that's built around the concept of people taking care of people. It's built around love. So why not change the way you look at your health and access to care? Join the Sedera medical cost sharing community where you'll not only have access to these amazing services, but you'll be surrounded by the love and caring of others just like you. Here's what I want you to understand. You don't need an insurance company to get great healthcare. In fact, you'll get the best care and best service you've ever had without them. The evolution of health insurance has led to a healthcare revolution. Secret number 3 is about making healthcare affordable again. Remember when I said that when it comes to health insurance, value is measured in terms of premium versus benefits? Well, when it comes to medical cost sharing, the value equation is monthly membership contributions versus what the community has agreed to share. And when you do that analysis, Sedera blows everything else out of the water. Earlier in the webinar, I showed you a comparison between an actual health insurance quote I got and what my monthly contribution would be with Sedera, and the difference was 62%. And that's just the beginning of the savings. And just for a minute, I want you to imagine how your life would change if you were saving 60% on your monthly healthcare expenses. What would that look like? Obviously, saving money is great, and there are plenty of things you can do with it, like loan it to your cousin. Wait, no, don't do that. Maybe like save for retirement. Or imagine how much better you'll sleep at night if you're now able to afford healthcare for your family. After being introduced to Sedera, I dove into the membership guidelines to find out what is shareable. Then I compared it to my health insurance options. It didn't take long to realize that this was by far and away the best option for me and my family. I couldn't believe how much better being a Sedera member was compared to being covered by insurance. I didn't just assume that Sedera was the best medical cost-sharing option either. I investigated several others. I scoured their websites, read their guidelines, attended webinars, and spoke to a few. I compared their shareable expenses and monthly rates, and what's interesting is they all have differences that make an apples-to-apples comparison kind of hard. A lot like comparing health insurance plans. But at the end of the day, Sedera was the best overall, the best in show, I guess you could say, and not just the best value and the easiest to understand, but the most technically advanced. Sedera was the winner, and I knew I had to spread the good news and share it with everyone. Now, I'm sure you're already aware that some industries have gone through incredible disruption in the last 10 years. Their traditional systems have been completely upended. We've gone from taxis to ride sharing, hotels to private rentals, employees to entrepreneurs, and bank lending to crowdfunding. And these are massive movements, yet they pale in comparison to what's starting to happen in health insurance. Healthcare spending is a $3.5 trillion per year industry. That's a mind-boggling number. The cost share model that started over 30 years ago in healthcare is emerging as the next big disruption. One of the first people we helped was our great friend and former business partner, Robert Morley. Robert is an attorney, and we knew if he liked it, then that would be a big validation because Robert's not easy to please. Well, not only did he like it, he loved it so much that he offered it to all his employees. At the same time, another friend of ours, Matt Tonioli, an endodontist, switched his employees to Sedera. They've both been with Sedera for over a year now, and they love it. And here's what Robert had to say about it.
I'm Robert Morley. I am the managing partner at Morley Mason. We are a law firm, small law firm. We do business in California and Arizona. We became a Sedera member last year around March, and we were with United Healthcare before. We have 13 employees. We were spending about $1,600 a month for a family, and we had gotten our renewal at that point, and it was another like $900 or $1,000. So it was going up from $2,400 or $2,500 for just the family, and it was becoming
For both of you?
no, just for one of us.
Going up to $2,500.
It was going up to $2,500 a month. And I think that was with a $1,000 deductible. You know, I understood it. I think where the rubber kind of met the road was with my wife, who we had to kind of relearn how we are using medical care, which I was totally willing to do because it saved so much money that we had so much leeway. The difference between $900 and $2,400, that you had to be a little bit more proactive. I have a 14-year-old daughter that we were up snowboarding, and she fell and broke her collarbone. And so we called Sedera, and they got us into a orthopedic surgeon that looked at it, and we talked about if she needed surgery, what would happen at that point. She didn't end up needing surgery, but I kind of went through the process of calling them, talking to them, and I was really impressed with the response and with kind of the plan, because they kind of set it out, and I hadn't had that before in insurance, and maybe it's because, again, we're not big users and I usually don't take care of it, but in this setting, I spoke to, I can't remember who was at Sedera, but I spoke to someone who said, okay, great, if the doctor orders surgery, then we want a second opinion and your IUA. So your IUA was $500, but if we would have gotten a second opinion, it goes down to $250. And what a great benefit, right? To get a second opinion if a surgery is needed, that's perfect. And I get paid for it. So it's like, that's a no-brainer. So I was really impressed knowing exactly what was going to happen, that if she went into the orthopedic surgeon and if he said that she needed surgery on that, then we would get another doctor to give us a second opinion just to make sure, because surgery is pretty invasive and she didn't end up needing it, but it was nice to know exactly kind of the steps that we were going to get there. So it was a good experience. So with Sedera, I've had the best healthcare I've ever had, and I've saved over 60% over the regular health insurance. And it's a lot of money. I mean, it's a ton of money to save, and we've used it, and it's worked.
So yeah, he's pretty happy with it, right? Well, health insurance is unaffordable for most people. It was for me. But thankfully, it's not the only way to get healthcare. You don't need insurance to get high quality healthcare. When you eliminate the insurance company and get rid of the provider network and the contracts and the overhead expenses and the shareholder profits, and then you take all the aspects of healthcare that are working and mix in personal responsibility and some healthy conscious living and the community sharing and kind of bake that all in the Sedera oven, you end up, voila, with affordable, high quality healthcare. I know it's kind of a cheesy analogy, but to me, it's like the perfect piece of chocolate cake. I love chocolate cake. So now I can have my cake and eat it too. So let's recap. Secret 1 is eliminating the middleman. Secret 2 is declaring your independence. And secret 3 is join Sedera and make healthcare affordable again. So it's not a unicorn. You're not dreaming. It's as simple as eliminating the middleman from the mix, declaring your independence by taking personal control of your healthcare, and joining the Sedera medical cost sharing community where fellow members have your back financially and where Sedera member services guide you through the system every step of the way. The result is the best healthcare you've ever had for 60% less than health insurance. How does that sound? Pretty good to you? Well, it sounded great to me, and I love it. But you know what? This isn't new, and you're not the first to try it. Over 1 million individuals and families in the US are currently participating in health sharing and medical cost sharing. Every day, participation is growing, and the national community is getting stronger. And Sedera is the best option I found. They have an A+ rating with the Better Business Bureau, which says a lot, and 0 complaints. So do you think this would work for you? How would it be if you lowered your costs by as much as 60%? Let's say that your monthly health insurance costs $600, and you save $360 a month by switching to Sedera. That's $4,320 a year. Think about what you could do with that. What would that do for your monthly budget? Well, how many of you at this point feel like the guy on the right? You're angry and a bit confused. Or maybe you're happy like the guy on the left, but still a bit confused. You're either upset you've been settling for the status quo all these years, or happy that you've just found out that there's a solution to your dilemma. Or maybe you're both. Either way, you're probably a little confused because we haven't talked about what medical expenses are not shareable. So I want to fix that right now. And I think the best way to do that is to cover these 3 things: membership principles, prior medical conditions, and 2 important sharing limitations. First, there are membership principles that you're going to be asked to agree to when you join. And here are the top 3 that you should be aware of. 1 is you agree to practice good health measures and strive for a balanced lifestyle. 2 is you agree to refrain from the use of any form of illegal substances, and this includes marijuana. 3, you understand that medical needs caused by or due to the act of performing any illegal or unlawful activity will not be shareable. All right? Hopefully you're good with those. Second, everyone is accepted. And that's because any treatment for medical conditions existing up to 36 months prior to your membership effective date are not shareable for the first 12 months of membership. The 36 months applies to all prior medical conditions, which are conditions you either received medical treatment for, took medications for, or exhibited observable symptoms from. Any prior medical condition which hasn't exhibited symptoms during the 36 continuous months prior to your membership effective date is considered cured and will not have any sharing restrictions. However, even if you do have prior medical conditions, they become eligible for sharing based on your tenure with Sedera. So like I said, for the first 12 months, there is no sharing. But for months 13 to 24, those related expenses are shareable up to $15,000. For months 25 through 36, it increases to $30,000. And from month 37 forward, it's fully shareable. And the following conditions, when well controlled through medication and/or diet, are not considered pre-existing: high blood pressure, high cholesterol, sleep apnea, and non-insulin dependent diabetes. Now, the exception is that if you've been hospitalized at any time during the 36 months prior to your membership effective date for high blood pressure or high cholesterol, then those would be considered pre-existing conditions. Also, tobacco users age 50 and older, until confirmed tobacco-free for 12 months, you have a shareable limit of $25,000 for cancer, heart conditions, COPD, and stroke. And third, there are limitations for maternity and limited sharing for prescriptions. If you have an expected delivery date within the first 12 months of your membership effective date, those expenses are not shareable. So be careful. If you sign up and you want to have a baby, that's awesome. Just wait 3 months before you get, you know what I'm saying. Now, normal vaginal deliveries and emergency cesarean section deliveries have an IUA of $5,000, and non-emergency elective cesarean section deliveries have an IUA of $7,500. Regarding prescriptions, there are two categories, curative and maintenance. Curative medication that's related to a qualifying medical need is shareable, and maintenance medications that are meds that aren't curing you, they're maintaining a condition, those are only shareable for 120 days following a new diagnosis. However, you can get prescription benefits from Liberty RX for just $27.50 a month, and you can add that to your Sedera membership when you enroll. And all the details are further down below here in the website. I encourage you to read the membership guidelines and FAQs. They're easy to read and understand, and if you have questions, just reply to the email I sent you when you signed up to watch this, or you can call me. My phone number is here on the website, or you can also call Sedera with questions. Remember all the testimonials we've seen throughout the webinar from Juliet, Lisa, Hakub, Jason, Robert? We've also seen and heard testimonials from Oscar, Natasha, and David about 2nd.MD, and from Laura about Teladoc. Now, I mentioned this is also working for employers like Crowder RV, Aztec Bolting, and Peak Tolan and Castaneda, but I didn't actually share with you what they had to say. The Sedera membership for employers is slightly different from the membership for you as part of the Pure Health group, but their experience is still relevant. Rick said, with traditional insurance, our employees continually felt like they made less and less money because their insurance kept going up. Every year, we would have to water down our coverage because of the 10 to 15% increase, not with Sedera. And Jeff said, now having entered into our third year with Sedera, I can confidently say Sedera is an excellent option to drive down healthcare costs for my business and employees while providing a high-quality healthcare solution. And Laz said, Sedera helps us put our employees first. Being a part of a healthcare sharing community keeps our employees healthy and relieves the financial burden. Before Sedera, we were only able to pay 50 to 60%, and now we're able to pay 100%, which provides more disposable income for them. When you compare our previous healthcare experience with joining the Sedera community, the difference is tremendous. There's no doubt in my mind we made the right choice for our team. So the point is, this works for just about everyone. It works for entrepreneurs, the self-employed, small business owners, people who work for a small employer who either don't have health insurance or have health insurance that's unaffordable. It works for anyone who doesn't want their healthcare tied to their employment, and anyone who works part-time or even full-time because they're working multiple part-time jobs. So are you one of these types? Do you see how this could work for you? Well, let's look at what you get with Sedera. What I want to do here is show you what an amazing value this is, specifically from my situation. Remember the slide where I showed you the quote from Standard Life for a short-term health policy, sort of matching what I get as a Sedera member? The premium for that was $1,765, so that's what I could expect to pay elsewhere for the same features, right? So when I joined Sedera, what did I get? I got a lot. The value of Sedera is really incredible to me. It's a completely different experience from health insurance because it's not health insurance. It's better. I get medical cost sharing, bill negotiation, actual customer service, a medical concierge, Teladoc, and 2nd.MD. I'm now part of a community that shares medical expenses where members help each other with their costs. I'm in the community with people like my friends, Robert Morley, Matt Tonioli, and Robert Attridge, and people I've never met but with whom I feel a sense of friendship, people like Jason and Lisa. I get expertly negotiated medical bills, which benefits me and the entire community. Keeping costs low for the community keeps your monthly contributions down. What's that worth? Well, it depends on the situation, but let's just say you have a $2,500 IUA and you incur a hospital bill of $2,500. Even though that's within your IUA, Sedera will negotiate the hospital bill down and in most cases get it reduced by 50%. That saves $1,250. If you had health insurance, the insurance company is going to reduce whatever the hospital bill is to the network rates, assuming you were treated in network. The problem is even the network rates are often twice as much as the cash pay rates, so you'd end up most likely paying $2,500. Sedera provides me with actual customer service, and they're there for me every step of the way, even when getting non-shareable treatment. I mean, just look at all the things they'll do for you. I also get a medical concierge, kind of like my very own captain, to help me navigate the healthcare waters. Is this something you get through your current healthcare arrangement? No way. Most likely the exact opposite is happening. You get networks that limit your access to providers, treatment protocols that your doctor doesn't always agree with, and a total lack of price transparency. Sedera's medical concierge is who you go to for help finding the right doctor or service provider and for getting cash pay pricing so you know before making an appointment how much it should cost. Then there's Teladoc, providing anytime, anywhere, 24/7 care where 92% of the time they're able to resolve your issue over the phone, which means you'll spend a ton of less time going to the doctor or urgent care. And with 2nd.MD, you never have to worry about getting the wrong or even unnecessary non-emergency surgery or wasting time and getting frustrated by having to go from specialist to specialist searching for answers to an ailment that no one can seem to identify. And finally, using GoodRx can save you up to 80% on prescriptions. So this is what I'm getting with the Sedera membership. Medical cost sharing worth $1,765 a month. Bill negotiation services worth $84. Medical concierge services worth $50. Teladoc worth $25. And 2nd.MD worth $250. But you know what? In reality, it's worth more. Just ask Steve. When an insurance company dictates treatment protocols, it can cost you time and money. In other words, money and more money. Steve, my business partner, told me his recent story about having knee replacement surgery. He has health insurance through his wife's employer who pays 100% of the premium, so nice deal when you can get it. But even then, listen to how his experience unfolded. These are his own words. He said, approximately 18 months ago, I started to experience serious knee pain. I went to an orthopedic physician who, after an MRI, determined that I had serious cartilage damage and a crack in the tip of my femur. The doctor told me that I needed arthroscopic surgery to correct it. At the time, I had a traditional major medical high deductible plan with a $5,000 deductible. The insurance company wouldn't approve the surgery until I followed a treatment protocol consisting of a series of injections. My surgeon informed me that these injections would have absolutely no impact on my condition, but I was forced to go through with them. Enduring these unnecessary treatments lasted 9 months, and they weren't pleasant. My doctor was correct, as they didn't help at all. We finally got the arthroscopy approved, and I had the surgery. I was responsible for the $5,000 deductible. Many months later, I was informed by the insurance company that although my surgeon and the surgery center were in network, the anesthesiologist was out of network, and I was billed an additional $1,300. Selecting the anesthesiologist was not within my control, and being charged for this out-of-network expense was ridiculous. Well, had Steve been with Sedera, he would have only been responsible for $250. And he would have been able to have surgery when he needed it without going through 9 months of unnecessary and painful procedures. Plus, there are never any out-of-pocket network issues. So compared to Sedera's medical cost sharing, Steve's health insurance cost him $6,050 more, plus 9 months of unnecessary pain and many hours of wasted time, not to mention missing out on activities that he would have otherwise participated in. Steve would have had a lower cost for that medical need. He would have received faster treatment. He would not have been inconvenienced by a middleman getting between him and his doctor. Since then, I'm happy to report that Steve joined Sedera and he won't be having those problems any longer. Getting started with Sedera is really simple. Enrollment is quick via the online onboarding, which you can access from here. Immediately after enrolling, you'll get an email with a welcome video, a downloadable info packet, and links to schedule a one-on-one new member welcome call with Sedera Services. You'll also get a link to register for the new member webinar and a link to register for Teladoc. There's also a link to the member website, which is where you'll go to submit bills for sharing and access all the other services. Overall, it's smooth and well designed and easy to follow. But John, Steve, and I want to make your experience even better. So we have some cool things for you when you become a Sedera Health member through the Pure Health group. The first thing you're going to get is a paperback copy of Health Wealth for You by Dr. Josh Luke. You'll also be invited to join our exclusive closed Facebook group where you'll get health news and tips, as well as reminders and educational information about your Sedera membership. You'll receive a weekly email with health-related info that we personally develop specifically for you as a medical cost-sharing member. You'll receive access to our Sedera Black Belt Masterclass, where you'll become a power user. The knowledge you gain will ensure that you get the most out of your membership. The better you understand it, the more value you'll get out of it. Just like knowing the features and functionality of your smartphone make it a more valuable tool for you. And finally, you'll get 3 custom t-shirts every year. And here's a look at the first one that we'll be sending you. This t-shirt will tell the world that you're a disruptor of the status quo, so wear it proudly. Here's a recap of everything you get when you join Sedera's medical cost sharing community and the value of it, as it relates to my specific situation. The sharing of medical expenses in excess of $500 that would otherwise cost me $1,765 a month. Expert bill negotiation that would save me at least $1,000 a year or $84 a month. The services of a medical concierge worth $600 a year or $50 a month. Telemedicine services from Teladoc that would cost me $25 a month. And with 2nd.MD, one consult would be $3,000 without the membership. So that's $250 a month. Plus you get the Pure Health bonuses. The book, the Facebook group, the HealthShare Reporter newsletter, the Black Belt Masterclass, and 3 t-shirts a year. So altogether, that's probably worth $50. So the total monthly value is $2,224. Your cost, or in this case, my cost for family coverage as a 49-year-old is only $662. Pretty incredible. For me, my options range from as low as $401 for a $5,000 IUA to $662 for a $500 IUA. If you're single between the ages of 18 and 29, your options range from $99 to $178. You'll find the rates by membership type and IUA down below so you can quickly find the rate that works for you. If all this did was give you the freedom to use whatever medical provider you wanted to, would it be worth it? Yes. If all this did was eliminate the provider network and give you the freedom to go where you want for treatment without having to worry about getting smacked with out-of-network charges, it would be worth that. If all this did was make it easier and faster to get the healthcare you need, would it be worth it? For sure, right? Steve had to wait 9 months and go through unnecessary torturous treatment before getting the procedure his doctor knew he needed, all because the insurance company has established treatment protocols which they required him to follow before he could get the surgery. Now, if all this did was get you the same experience you get now with health insurance, would it be worth it? Of course it would. At least you'd be paying up to 60% less for it. Let me ask you a quick question. How much would it be worth to you to save 60 or even 30% over your existing health insurance? How much would it be worth to now be able to afford healthcare? When I say worth, I'm not talking in terms of dollars. I'm talking about the other advantages, like the peace of mind you get from knowing you have taken control of your healthcare away from the middleman administrators and knowing that you're no longer reliant on an employer for insurance. And what about how empowering it is to know that you are not going to be a victim of the system any longer? There's an incredible amount of security knowing that you're no longer at someone else's mercy, no longer dependent on their system. Everyone needs healthcare, and unfortunately, health insurance is only one way to pay for it. After I left my job, I went without health insurance because I couldn't afford it. I eventually purchased a short-term association policy, which was better than nothing, but I still felt underinsured. And it wasn't until I found Sedera and thoroughly researched it that I knew everything was going to be okay. Insurance that would provide me close to the same as Sedera was just unaffordable, out of the question. So what are you going to do with this information? You have 2 options. Don't do anything, go home, keep doing what you're doing, or Take action now and dramatically improve your current situation. Make a change or keep doing the same thing and hope things improve. You know the current system is broken and that the only way to fix it is to replace it. No amount of regulation is going to work. That's been proven. The insurance companies sure aren't going to fix it. Why do you think the 3 largest employers in the US have formed a joint company to deliver healthcare to their employees? To disrupt the status quo, that's why. They know it's the only way they'll get control of the healthcare costs and improve their employees' lives. So join me and together, we'll participate in the medical cost sharing movement and help disrupt the status quo health insurance. Well, down below, you'll find a list of questions and answers, but let's go over 3 of them, 3 of the most frequently asked ones here, really quick. If you have any questions that you don't see down below on the website, or if there's something you don't understand, just give us a call, or you can call Sedera directly. So what happens when a provider requires payment up front for services? Well, you might be required to pay out of pocket for medical services. If that happens, you should try to avoid paying more than your IUA and ask the provider to bill you for the difference. If you do end up paying more, it diminishes Sedera's ability to negotiate with the medical provider. But don't worry, if you do end up paying more than your IUA, you still have the community behind you to help share ineligible expenses. It's important to contact Sedera the second you schedule surgery or have a provider that's requiring a large amount up front. And remember, needs payments are sent directly to members, not to medical providers. If there is no network, what is the method used to secure fair pricing? Well, all Sedera members are cash pay patients. This gives us significant leverage in the negotiation of your medical bills. For this, we use a professional patient advocacy and medical bill negotiation company that serves nearly 1 million patients' lives throughout the US, and Sedera coordinates the negotiation of all member medical bills that exceed $1,000. The average rate reduction after a negotiation is 50%, and these savings are passed on directly to you through low monthly membership contributions. What is the process for paying my medical bills when I have a need? At the time of service, you should disclose to your medical provider that you are a cash pay patient. Your provider will in turn bill you directly. Then you'll fill out a need processing form and submit it to Sedera along with copies of all related medical bills and any proof of payments you've made towards your initial insurable amount. Sedera's team of medical bill negotiators may contact the providers to discuss the appropriate payment for their services and determine if negotiations are necessary or available for the billed amounts. Sedera will then review the need and send you community funds to cover the cost, less your IUA, and then it's your responsibility to use those funds to pay your providers. So, are you ready to join the medical cost sharing movement and be a healthcare disruptor? If you are, you'll get the best healthcare you've ever had for up to 60% less than insurance, and in some cases more. There's no open enrollment period. You can sign up at any time, but if you join before the 20th, then your membership will take effect on the first day of the following month. Well, that's a wrap. Thanks for sticking around and watching. Because you were awesome and stayed to the very end, we're going to email you these 2 ebooks for free. Heal Yourself and Stress Less. They're short, easy to read books with great information, and they'll help you live a healthier life. So please let us know if you have any questions. Otherwise, you can sign up now and welcome to the ranks.